Hi everyone, welcome to Very Interesting. I'm obviously not Barry Aycock, but tonight I'm your host. My name is Michelle Aycock, and we'll be discussing a very important topic of rural healthcare in Missouri. There's a lot to discuss as Sue Ann Williams, CEO of SoutheastHEALTH in Dexter, joins us to discuss the challenges of rural healthcare and what SoutheastHEALTH is doing specifically to address those challenges. We're also going to have a premiere, a little preview of our new show, In the Arena, that will be premiering on Aycorp Media next Tuesday night, so you won't want to miss that. Hi everyone, my guest this evening is Sue Ann Williams with SoutheastHEALTH. Thank you for joining us tonight,
Thank you, Michelle. Glad to be here.
We're glad to have you. So you're here to talk to us today about a lot of things, but first let's talk about your background. Give us a little history on Sue Ann Williams. How did you come to be in the health field, and a little bit about who you are?
Sure. So, back in 35 plus years ago, my husband and I moved here to Dexter. We moved here from a small rural community in southern Indiana. I actually worked for a hospital bed manufacturer, 𝐷𝐻𝐿, so I knew when we moved here I wanted to stay in healthcare of some sort, so there was a position open at a clinic actually across the street from the hospital in Dexter. And so I took the position as a receptionist. I started there, and I expanded to practice management, then clinic administrator, and then most recently I came on with SoutheastHEALTH, and I was an assistant administrator, and now I'm CEO, and I've been the CEO at Southeast for 5 years.
Congratulations.
Well, thank you.
You certainly worked your way through different areas. You've seen lots of areas of healthcare.
I sure have.
And over the years, I'm sure there have been so many changes, good and bad, I would imagine.
Right, you're right. A lot of changes in healthcare.
And today we're going to talk about some of that, correct? So let's talk about rural healthcare in general. Inevitably, there's going to be a need for emergency services, emergency healthcare services, clinic. Definitely if you have kids of any age, you're going to have access to that. So for people who live in rural communities, what are some of the factors that affect their healthcare?
So in rural Missouri compared to our urban counterpart, 20% of the population is over the age of 65, compared to 14% in our urban areas. Okay. In addition to being elderly, they're sicker, lower income, more unemployed. They're more likely to be obese, to abuse tobacco. In addition, they die from stroke, cancer, heart disease, respiratory disease, and unintentional injuries such as car accidents and farm accidents.
That's especially true for our area. We've seen that, haven't we?
So they're sicker and they have more health problems than our urban counterparts.
So you're seeing that in the elderly population. Are there any impacts or health factors or risks, I should say, for the other age areas or age categories of rural communities?
So I have a slide I'd like to share with you, and as you can see, as you notice, Southeast Missouri is darker. We are ranked lowest in those factors that affect health. And then I have, as you can see on the other map, where again Southeast Missouri is darker and is ranked lowest on health incomes, meaning we have a shorter lifespan and lower quality of life than our urban counterparts.
So why is that? What is the correlation there, do you think? Between
lack of health care, lack of providers, lack of access to emergency rooms, primary care physicians, clinics, hospitals in rural areas.
So the thinking is that if access is better or easier to get for just the general population in rural communities, that we're going to be healthier, there's going to be more preventative care. Is that correct?
That's correct.
All right, so Sue Ann, in our rural communities, we tend not to have as much access as urban areas do. So can we talk a little bit about that?
Actually, I have a slide that speaks for itself. As you can see here, the rural Missouri compared to our urban, it's alarming. Our smoking rate's higher, obesity rate's higher, life expectancy is lower, our cancer rates are higher. So it's alarming to show the difference we have a greater health risk in rural Missouri than we do in our urban counterparts.
So if we have better access, more plentiful access or availability to healthcare in our rural areas, then we would see these numbers drop.
Better outcomes. We would have better outcomes. We are able to do better if we just have access to health in our rural areas as our urban counterparts do.
But unfortunately, what we're seeing, instead of more healthcare options, unfortunately in our rural areas, is a decline to access. Is that correct? Let's talk about hospitals and the access there.
That's correct. And it's no secret that since 2014, we've had 15 hospital closures just in the state of Missouri, and 4 of those have been in our rural area. Three Rivers in Kennett, Black River in Poplar Bluff, Ellington and Doniphan. So when hospitals close, people lose their jobs, communities, businesses either move or they completely close. And 2 to 3 years after a hospital closure, it's been proven that a third of the tax revenue in that community dry up. So closures not only also affect healthcare, it affects the whole community.
That's a great point, because I think a lot of people don't think about those other aspects besides just the access to healthcare. So once those hospitals close in those regions, there's almost like a ripple effect in the community, and it affects the community long term, not just immediately.
Exactly. We're in this together. It's not just, like I said, it's not just about the house, the hospital, and the employees. It's about the whole community. It's a team effort.
So Sue Ann, with all these hospital closures that we've been talking about, I understand that there's still a need or a vacancy of physicians. Is that correct?
There is. We continue to recruit physicians in rural areas, primary care physicians, but it used to be where physicians would do both hospital work and clinic work or outpatient work. Now in schools are being trained either do inpatient hospital or an outpatient setting. So we had to transition into our rural areas. And not only do you recruit the physicians, you also have to recruit the spouse. And most of them, the urban is more enticing. There's more to do. So we continue to work on that. We've actually just hired 2 new primary care physicians in the region, and we're excited. They're both from rural areas. So
that's exciting.
It is exciting because they're out there. We just have to think outside the box in a way to recruit them. In addition to providers, it's also a shortage in registered nurses. You have to think of strategies in our ever-evolving market to find ways to keep them in our rural areas.
Sue Ann, we're going to take a break right now, and we are going to cut over to Barry. Barry's going to introduce a new show coming up next Tuesday, or this coming Tuesday, on Aycorp Media. The show is entitled In the Arena, so be watching for that. Barry?
Welcome, and I'm here to introduce our new show, In the Arena. To my right is our new commentator, Lloyd Smith. Lloyd?
Well, thank you, Barry.
Welcome.
I'm glad to be here. Many of you may know me. I worked in politics for around 32 years, beginning in 1980 with the Bill Emerson organization and coming all the way through until I ran the Republican Party for 4 years. And glad to be here, and glad, hopefully, to bring some discussion that will bring meaning to the area, and glad to be on the program In the Arena.
Well, you've got a big perspective more than anybody else, probably in Southeast Missouri. You bring a lot of history with it, so we're proud to have you, and welcome aboard.
Thank you, Barry. Glad to be here.
Thank you.
Much so.
Former State Representative Phillip Britt to my left. Phillip, why are we here today?
Well, I'll introduce myself first, if you don't mind. Phillip Britt. I did have the pleasure and honor to serve as state representative for the 163rd district. It's no longer the 163rd district down here, but it was then, which was part of Dunklin and Stoddard and New Madrid and Butler County. Had parts of 4 counties back at what I like to call the turn of the century. Sounds a lot longer ago than it was. I left that position and for the last 18 years served as the treatment court commissioner here in Dunklin and Stoddard County. I'm a student of politics, always have been. I have a degree from Southeast Missouri State University in political science and a law degree from the University of Missouri Columbia. Love the opportunity to talk politics. Lloyd Smith and I have known each other for probably 25 years. We've been on different sides of issues before, but we've always been able to work together, and we felt like that this was a great opportunity for us to be able to Barry and I first talked about this, we thought we wanted a show that was much more civil than the discourse that we see today. There's lots of anger, there's lots of animosity in politics these days, and we wanted something that would allow people to talk about issues and talk about their perspective, but not in an angry way, in a way that is more about conversation than debate. And so we talked quite a while, and we got Lloyd involved in some of those conversations, and I'm real proud of the team we've put together, and I'm looking forward to being part of this show.
Yeah, and I'm just glad to be a small part of it. I'm here to make sure that Lloyd and Phillip don't get in a fight, but I mean, we're going to have fun doing this. We're going to poke at each other a little bit, but we're going to be civil while we do it because we have a lot of respect for each other. Like Phillip said, I've been an opponent of Lloyd's for many years, back in the Wayne Crouch days. Jerry Ford was a little bit before my time, but I'm sure I would have been on Jerry Ford's team back then. So, we've had fun reminiscing about some of the old wars that we shared together, even though I was in my youthful prime at that time, and you were in your youthful prime at that time also.
Oh, absolutely, Barry. And the folks should know that In the Arena actually comes from a speech that Teddy Roosevelt gave in 1910 in France. It's called Citizenship in the Republic. And that quote ends something like this: not with the tired and timid souls who know neither victory or defeat, but actually in the arena. And so glad to be here, glad to be a part of this, and hopefully we can bring shed some lights on some of the issues and why certain people believe certain ways about those issues, and do it in a civil way that will make a difference, and people can think a little bit deeper about what's going on in politics today than maybe just what they read in the headlines or the first 10 seconds of the news.
Correct. And we talked a lot about that before we come on. A lot of people don't get their information from newspapers anymore, and they get it online or in a 10-second flash on CNN or Fox News headline, and sometimes those aren't exactly facts. So we're here to bring you facts, we're here to be civil, we're here to just have some fun and give some analysis to politics as we know it today. Phillip, we'll give you the last shot here.
Our first episode will be we'll drop next Tuesday evening. We look forward to sharing our perspective on presidential debates. As you know, the presidential debate just happened, and we're looking forward to being able to share that with you. But we're going to give you a little history lesson first. We're going to talk a little bit about presidential debates, and Barry's going to bring an interesting perspective because he's actually sat in on one of those debates recently, and so he's going to give us a little perspective on what that was like. So I look forward to seeing you next week, October the 6th. And so until then, we'll see you in the arena.
Welcome back, everyone. So, Sue Ann, we've been talking about hospital closures and the issues addressed, or the challenges in rural health care. What has Southeast done to address those issues? I mean, they've remained a very strong presence in our rural communities. So let's talk specifically about what Southeast Health is doing in the areas.
Okay, well, Southeast is committed to providing health care to our primary rural areas. Currently, we have 8 rural health clinics, 1 in Bernie, Malden, Bloomfield, 2 in Dexter, 1 in Poplar Bluff. We recently opened a new clinic in our New Madrid market at their request. They knew there was a need. And we also opened a pediatric clinic in Sykeston. So they are providing clinics in our rural areas. And in addition to, as I spoke earlier, we have an elderly population. They have trouble with transportation to our Cape campus, so we are bringing specialty service to them. We currently have cardiology, gastroenterology, we have chemo and infusions at our Dexter campus, and we're looking to expand that. We also have occupational medicine and orthopedic group that we just opened last month. So we are bringing the specialty care to our rural communities.
And Southeast seems committed to improve on the systems they have in place. For example, the emergency department was upgraded not too long ago, and that's very exciting.
In 2018, we expanded our 5 exam room emergency room to 10. We have 10 exam rooms in our new state-of-the-art emergency room with 5 behavioral health rooms adjacent to the ER for behavioral health patients when they're in crisis. In addition to that, we put in a 15-bed adult voluntary behavioral health inpatient unit above the emergency room. It's a quality to provide quality care and safe for our patients and our employees. So they're committed. They're committed to rural health. They're committed to behavioral health. As you had said, they're a strong organization, and they're here. They're here for the communities.
So to give our audience some idea of the services, or especially as it relates to the behavioral health rooms and the unit there at the Dexter campus, are you busy with that? Do you admit patients often? Let's talk a little bit about that.
We're certainly serving the need of our community. In addition to that, Southeast and Cape partnered with Universal Health Systems, and they are opening in 2021 a 100+ behavioral health hospital in our Cape campus. So,
and I think if anyone drives up I-55 from the south, they'll be able to see that construction going on. That's exciting. It's obvious there's clearly a need. Our area, from what I understand, you can correct me if I'm wrong, but our area has lacked that impact or that help for so long for those who need the behavioral health services. So can we talk a little more about the partnership with Universal Health Systems?
Missouri has a population of 6,223,000 Missourian adults have a severe mental illness, and 65,000 children, adolescent have a severe mental health illness just in the state of Missouri. 90 of our 114 counties in Missouri does not have a mental health provider to treat.
That is astonishing.
Is it not? So Southeast saw the need. They stepped up. They put the 15-bed behavioral health in Dexter, and now they're partnering with UHS to put one in Cape.
And they are one of the first in our area to do so.
You're right, exactly right.
So they're leading the way for others, and hopefully everyone will get on board and address the need that's there with mental health.
The Rural Missouri HPSA score, which is the health professional shortage area for mental, shows a severe shortage. Southeast Missouri has a real need. Opioid and substance abuse is one of the greatest public threats in rural areas. Overdose deaths are now higher than traffic fatalities.
That's amazing. I had no idea.
So,
and you know, we're talking about the people affected by those diseases, but it also affects families, doesn't it?
you're right, exactly right.
So there's the need there. And so as any hospital takes leadership, like I said, I hope others will join in and address this, because it's a widespread need, obviously.
And it's not going away.
It's not
It's
going
just
away,
going to get worse, and we need to be there for our patients.
So Sue, in another avenue that Southeast Health is addressing these challenges, or another way Southeast Health is addressing these challenges, is through telehealth medicine. So tell us a little bit about that.
Well, telehealth would be a way to bridge the gap in our rural areas where there's not primary care. We currently have an endocrinology telehealth clinic in our Dexter campus, which is going over well. The problem right now in rural areas with telehealth is it's not well funded. It's used more in the urban areas because the population is younger, and 22% of Missouri lacks high-speed internet.
True. That is a challenge.
It is a challenge. I think we'll get there, and I think it's a way to help bridge the gap and treat our patients, but we're moving to that. So it's the future. I think what I say is stay tuned.
Sue Ann, thank you for being here today. We've covered a lot of ground, a lot of information, but one thing's clear. Southeast Health is doing their part and more to pave the way for healthcare in our area. And so stay tuned, everyone. I think we'll have more to see and more to talk about down the road. Thank you for joining us tonight on Very Interesting. Next week, Barry will be back, and we'll have Senator-elect Jason Bean and his wife on the program. We will also have a profile of Kinderhouse Ministry, which is a faith-based transitional living home for men in recovery. So be sure, join us next week. You won't want to miss it.